more important work to be about than improving the health of the people of North Carolina. And we're so grateful that you have been working on this for years. Your first bill, I think, was developed 4 years ago, and you've been passing bill after bill as we have continued to, in our words, chip away at the most important public health issue of our time. And you've made enormous progress, some of which you've already outlined today, and this bill will complete one of the pieces, one of the strategies on the book of business to improve the health of people of North Carolina. The leading causes of death in our state are cancer, cardiovascular disease, stroke. Smoking is a risk factor for all of those, a contributor. And we know that, I want to make 4 points. I don't want to cover the ground, but you're also knowledgeable and you've got the science down pat because you've been working on this. I don't want to cover the ground that you've already laid out so eloquently. I'm just going to make 4 points, and one is just to underscore that secondhand smoke is a serious health hazard, and that's been clear since the Surgeon General's report in June of 2006. And there is no level of exposure to secondhand smoke that is not dangerous. And if you listen to the comments that have been made, you do know that secondhand smoke increases the risk of heart disease to the non-smoker who's exposed on a regular basis by 25 to 30%. Lung cancer, the risk is increased by 20 to 30%. Stroke, also a risk is increased, as well as one thing we haven't mentioned, which is that pregnant women who are exposed to secondhand smoke have an increased risk of having a low birth weight baby, and our infant mortality rates are stuck in North Carolina, and we believe that chronic disease and risk factors like exposure to secondhand smoke is one of the reasons that we're stuck. Second